CTSI stands for the Clinical and Translational Sciences Institute at Michigan State University. Its goal is to move knowledge from the ivory towers of the university out to the community at large. So we want to take advantage of all the great research that's going on here at the university, research at other universities that we're collaborating with, and hopefully facilitate the funneling of that knowledge to the benefit of the citizens of the state. In order to foster the movement of knowledge, we need to involve our communities in these types of research efforts because they're the ones that are eventually going to be impacted by it. The only way you're going to be able to know is if your potential therapy is going to impact on these individuals is if you actually engage them in the opportunity to do the initial studies to prove whether it works or not. And so the role of CTSI, as I said earlier, is to move and migrate knowledge back and forth. It goes both ways. We want to make accessible to the citizens, to the community of the state of Michigan, the ability to interact with our researchers and participate in this process of learning new knowledge. Being on the front lines, if you will, not only as research participants, but learning about the nuances of research, to be able to talk to clinicians or other researchers and input their ideas and thoughts on how a certain intervention may or may not work in their community or their population, if you will. And so I think there's a great strength in engaging our communities because that's going to be what it takes to actually show that certain interventions we're trying to invent at the university or elsewhere can actually have impact on the citizens that Michigan State interacts with.